before we start, to invite Dr. Naydene Williams to open today's events and the ceremony under the theme Mental Health in an Unequal World. The have and the have nots. How did we get here? That is our theme for this year. Please welcome Dr. Naydene Williams, Director of Health Services Planning and Integration, Mental Health, Ministry of Health and Wellness. All right?
Good morning, everyone. Good morning, everyone. I do hope you're all able to hear me. I am seeing myself twice. So you are able to hear me. I'm just having one little glitch and I will be with you in 1 second.
Dean Williams. I would just like to mention some of our sponsors here that have made it possible for us to bring this conference here to you. We want to thank the Pan American Health Organization. We also want to thank the Ministry of Health and Wellness, the Western Regional Health Authority, as well as the National Health Fund. Some of our other sponsors include the Sagicor, Pfizer, Janssen, Hilton Hotel, as well as Discount Lumber. We'd also like to thank especially Kiss Baking for helping us bring this conference together. As I said before, our theme is mental health in an unequal world, the have-nots, and how did we get here. We'd also like to just introduce our moderator at this time, who will be Dr. Patrick Prendergast, who is the director of the University of West Indies Mona Campus, WJC. We await Dr. Naydene Williams just for the proclamation, the opening of our sequence of events. It is a 3-day conference, just so you guys know. Today is just the opening day, all right? And it is opening of Mental Health Week as well, and nationally. All right, so welcome Dr. Naydene Williams again. Can you hear us?
I can hear you. Can you hear me?
Yes, we're hearing you very well.
Can you hear me? Let me go ahead. The proclamation, the World Mental Health Day, October 10, 2021. The theme, mental health in an unequal world. It is my pleasure to bring this proclamation from our Governor General, Sir Patrick Allen, on behalf of the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton. And it reads, whereas the World Health Organization, by its primary focus, mental health care for all. Let's make it a reality. Is charging all of us to assist in addressing the theme above. And whereas the current COVID-19 pandemic has exacerbated pre-existing mental disorders and precipitated onset of mental distress and disorders, and whereas this COVID-19 pandemic has impacted on mental health services, and in doing so, it also magnified disparities that exist in mental health services. Adverse impacts including disruption of the access to regular mental health service, widening of the gap between the need for treatment and availability of treatment, disruption of the supply of regular psychiatric medication, further delay in access to improvement in social, psychological, and medication, which may have proven efficacy in enhancing quality of life of persons living with mental illness. Decreased access to socioeconomic opportunities, example, jobs, training, housing. And whereas the World Health Organization recognizes traditionally mental health budget has been utilized in funding operational cost for specialized mental health services, and whereas the World Health Organization recommends greater mental health investment and reallocation of resources to more equitable, cost-effective, community-based services, and whereas many people who suffer from psychological and mental distress, personal crises, and mental disorders may be at risk to attempt suicide, now, therefore, I, Patrick Linton Allen, member of the Order of the Nation, Knight Grand Cross of the Most Distinguished Order of St. Michael and St. George, Commander of the Order of Distinction, Governor General of Jamaica, do hereby proclaim October 10, 2021 as World Mental Health Day in Jamaica, and encourage all citizens to join in year-round efforts to take part in whichever way possible to allow greater investment in mental health, thus providing greater access to quality mental health services inclusive of support services. Your activities may vary and include provision of jobs or training opportunities or other support services. We are also encouraged to have a general attitudinal change from one of stigmatization and discriminatory actions to one of acceptance and inclusion. The role of policymakers in including reallocation of resources and increase mental health investment in community-based services will go far way in addressing the disparities in mental health services. Additionally, policymakers need to facilitate provision of the necessary infrastructure to ensure nobody is denied access to mental health services due to being poor or reside in remote places. All of us need to advocate for these provisions to be made with a sense of urgency. I further urge all citizens to participate in the activities designed for the observance of World Mental Health Week. Thank you.
Thank you, Dr. Naydene Williams from the Ministry of Health and Wellness for that proclamation. A wonderful way to start our proceedings. And before that, we had Dr. Gavin Austin. He's a medical officer, Department of Psychiatry at Cornwall Regional. And we want to thank you both for opening up for us. My name is Patrick Prendergast, and I'll be your moderator for this morning's opening ceremony. As mentioned before, this is just the kickstart. So thank you all, distinguished ladies and gentlemen. I greet you well, and I really thank you for taking the time out to join us as we kickstart our National Mental Health Week 2021. First, I want to say that I'm not accustomed to being a constant presence at the microphone. Over the several years that we've been doing this, I got a little bit comfortable, I should say, taking the privilege of coming in and making my provoking remarks, then sitting back and participating where necessary, but really and truly just engaging in the really excellent presentations that we have had over the years, coming from the speakers. Yes, I would sometimes be drawn into the activities and delightfully participated. But it's not that I'm complaining. I happen to be the chair for today, and I'm really, really very happy to do that for you. So, I'm not going to be talking for long, to be honest, because as you know, we have a very long morning, should we say, and we don't want it to be too long a morning. So let's get straight into the meat of the matter. We are marking World Mental Health Day under the theme, Mental Health in an Unequal World. Our National Mental Health Conference 2021 expands that global focus further and speaks to the haves and the have-nots. And we try to answer the question, how did we get here? The organizers of this conference have pulled together a dynamic set of speakers spread over the week, and they will not only seek to answer that question, but also to help us provide some directions on how we may get to a better place in meeting the overall target in promoting mental health and well-being. So speaking of getting to a better place, let us get our opening ceremony on the way with a special selection from Hearts in Service. And that will be followed by prayer, which will be delivered by Dr. Derek Harvey.
Let us pray. Father, we thank you for the opportunity of life as we are here this morning, starting the activities of Mental Health Week 2021. Lord, the theme says mental health in an unequal world, the haves and the have-not. How did we get here? It is only through your Holy Spirit, Lord, and your guidance that you're able to lead us. As we go through the week, Lord, particularly today, we ask that you guide those who spread their word, given to you by through them, that we may be blessed. For those who are administrative in the mental health world, Lord, we ask that you continue to guide them, that they may make policies which improve the health of all. Particularly at this time, Lord, as we remember the pandemic, COVID-19, and the stress which it has, not only on those who work within the field of health, but throughout the whole world. Those who are coping with unemployment, those who are locked away at home. Lord, we ask that only through you can we know that you have done it. We know that you will do it in the future. So Lord, as activities, we ask that you continue to bless us, guide us, protect, so that we may preserve our mercies, we ask in and through you, Jesus Christ our Lord. Amen.
Not hearing.
You didn't hear me, sir?
Can you hear me now?
Yes, you're clear.
Thank you. I was expressing thanks to Dr. Harvey and Heart in Service for getting us off in the right spirit. I'm also saying that I want to make a few comments as the campus director, taking moderator's privilege, of course, because I really think it's important for us to underscore our commitment at the University of the West Indies, Mona, Western Jamaica campus to this important exercise. It is an exercise that continues to bring focus to an area of health that is unfortunately still not getting the kind of attention needed. Without a doubt, the COVID-19 pandemic has brought the issue of mental health up front and center right across the globe, in education, in sports, in the workplace. We have seen how man, the social animal, has been responding to both the restrictive conditions wrought by this pandemic and the uncertainties and unpredictability in the way we manage the varying aspects of the disease. Sometimes the messaging and the actions get so schizophrenic, one wonders. Unless we are people in severe denial, we must accept that much more needs to be done to keep humanity healthy, to keep our world safe, and to keep our people sane. We here at UMONA WJC are actively engaged in promoting the building of sustainable cities and communities. And we're speaking about sustainability in all its dimensions: environmental, social, physical, financial, economic, health, everything that speaks to overall well-being. And we obviously, therefore, support the UN Sustainable Development Goal number 3 to ensure healthy lives and promote well-being for all at all ages. We know that people are living in challenged settings are at greater risk of mental health difficulties, especially for children, young people, and the older folks, for whom social isolation and loneliness are simply not good. We are also seeing firsthand the unequal underbelly of our systems. Inequalities stare us straight in the face, and people are hurting on all levels and at all stages. We cannot lose this opportunity to make a real difference in addressing the issues that will bring equity in mental health. Chief
Dr.
among
Patrick
them,
Prendergast.
Chief among them is the inequity in financial investment in mental health. Simply put, we must address the under-resourcing of mental health care if we are serious about dealing with mental health in an unequal world. And that is a call that we are prepared to support here at the WRHAMr WJC. And we'll continue to make as active partners in promoting mental health and well-being generally and across the Western Jamaica region specifically. Having made those comments, I'm going to turn it over to the officials to bring their welcoming remarks as well as greetings. And I have two lined up at this particular time. We're going to hear from the Minister of Health and Wellness, Dr. Christopher Tufton, and we're going to hear from the PAHO representative. Well, let me just tell you a little bit about both gentlemen. Dr. the Honorable Christopher Tufton, Member of Parliament for West Central St. Catherine since March 2016, is Jamaica's Minister of Health and Wellness. Dedicated, passionate, and goal-driven, Dr. Tufton received numerous achievements during his tenure in public office. Dr. Christopher Tufton served as President of the Pan-American Health Organization Directing Council meeting and led the 59th meeting of the 35 PAHO member states in Washington, USA from September 20 to 24, 2021. The meeting was timely and of great significance as countries around the world continue to combat the coronavirus COVID-19 pandemic and reinforce the resilience of their healthcare systems. A graduate of the University of the West Indies and Georgia State University with undergraduate and graduate degrees in management studies and marketing respectively, Dr. Tufton holds a doctorate in business administration from the Manchester Business School, University of Manchester in the United Kingdom. Minister Tufton will be followed by Mr. Ian Stein, the Pan American Health Organization, World Health Organization representative in Jamaica, Bermuda, and the Cayman Islands. Mr. Stein was appointed PAHO WHO representative to Jamaica, Bermuda, and the Cayman Islands effective September 15, 2021. Mr. Stein comes to the job with substantial experience in developing and maintaining partnerships for health, the management of health crises, and a broad range of public health topics, including immunization, early child health, health promotion, environmental health, and HIV/AIDS. As the incoming Pan American Health Organization, World Health Organization representative, Stein will lead the organization's collaboration with ministries of health. His highest priorities include the COVID-19 response, strengthening health systems, and preventing non-communicable diseases. Let us hear from Minister Tufton and Representative Stein in that order.
Director, University of the West Indies, Mona, Western Jamaica Campus, and today's moderator. Mr. Ian Stein, representative of the Pan American Health Organization, WHO, Jamaica, Bermuda, and the Cayman Islands. Mr. Everton Anderson, CEO of the National Health Fund. Dr. Kevin Goulbourne, Director, Mental Health and Substance Abuse, Ministry of Health and Wellness. Dr. Derek Harvey, Senior Medical Officer, Cornwall Regional Hospital. Members of the media, ladies and gentlemen, one and all, good day. The COVID-19 pandemic has laid bare prevailing social and economic inequalities globally, and with some far-reaching negative implications for mental health of individuals the world over. The last year and a half have seen the doors to classroom closed to children, putting at risk the capacity of many to earn a livable wage in the future, even as we battle the digital divide. Adults have lost jobs, jeopardizing their ability to provide for themselves and/or their dependents. All have suffered psychological impact, including fear, anxiety, and depression. We also have increased risk of suicide. Research has shown that among the risk factors for suicide are family disruption, relationship problems, social isolation, trauma, grief, loss, and economic problems. a lot of which people have had to endure during this pandemic. COVID-19 has also dealt a blow to mental health services. A 2020 survey by the World Health Organization, the WHO, showed that some 93% of countries had had their mental health services disrupted or stopped. Conducted in 130 countries across 6 regions, the survey saw 60% of the participants reporting disruptions to mental health services for vulnerable people, including children and adolescents, 72%, older adults, 70%, and women requiring antenatal or postnatal services, 61%. Some 67% experienced disruptions to counseling and psychotherapy. 35% had disruptions to emergency interventions, and 30% saw challenges with access to medication for mental, neurological, and substance use disorders. This is coming against the background of a pandemic when, according to the survey, countries were spending less than 2% of their budgets on mental health. And in a world where now only a few have designated budgets to fund mental health and psychosocial support. As difficult as the experience of the pandemic has been, however, it can also be a game changer for us, certainly in our prioritization of mental health and in recognizing the linkages between mental health and inequalities. We understand that job loss, for example, can negatively impact an individual's mental health, and in particular, where that individual was already vulnerable due to factors such as age or limited education attainment. We have the opportunity to fast track and scale up the reorganization of mental health services now needed to build a resilient mental health system. Such a system should reflect the continued shift from institutional care to community-based services, ensure coverage for mental health conditions, inclusive of substance use disorders in health insurance packages, and deliver quality mental health and social care in the community through building the necessary physical infrastructure and human resource capacity. The Ministry of Health and Wellness is committed to this. We continue to progress the WRHAMr's intervention to help to address the psychosocial needs of persons impacted by COVID-19. Already, we have more than 100 rangers trained in psychosocial first aid and who are available to speak with members of the public who are in need. All that is required is that persons book their appointment to speak to a ranger via the mental health page of the Ministry of Health's website at www.moh.gov.jm. Access to counseling and referral is also available through our mental health and suicide prevention helpline at 888-NEW-LIFE, that is 888-639-5433. Calls to the helpline doubled between April and June 2021 when compared to the same period this year, from 231 calls compared to 533, a reflection of the challenge that we face in mental health. Public education and awareness raising to break down the stigma and discrimination that serve as a barrier to care. These actions include digital and billboard advertising with key messages from the Speak Up, Speak Now campaign, the Time Out Tuesday theme trend online, which promotes dialogue on mental health, and the ministry's mental health page on www.moh.gov.jm/mental health, which offers a variety of knowledge building and experience sharing resources. We are in the process of rolling out depression screening in our primary care clinics with the goal to identify the illness early to decrease the likelihood of long-term complications or otherwise poor outcomes. We have also begun the work to increase the capacity of mental health workers in child guidance clinics across the 4 health regions. This is being done through training made possible by the support of the Pan American Health Organization. We are also improving the physical and IT infrastructure at our health facilities through our health system strengthening program, which should see the enhanced delivery of both primary and secondary care. In conclusion, as we contemplate mental health in an unequal world this year, let us commit to working together to both create and promote necessary enabling environment to realize and sustain equity while safeguarding the mental wellness of all. This, ladies and gentlemen, includes redoubling our efforts to bring an end to the stigma and discrimination that has plagued persons living with mental illness in order to safeguard their access, not only to medical services, but also to training, jobs, and other opportunities. Thank you very much, and have a good day.
Yes, today, Minister. Okay. Minister Tufton, Minister of Health and Wellness, Dr. Kevin Goulbourne, Director of Mental Health Substance Use within the Ministry of Health and Wellness, Dr. Patrick Prendergast, the Western Campus Director of the University of West Indies Bonus Campus. Thank you for addressing that echo. Dr. Naydene Williams, Director, Health Service Planning and Integration in the Ministry of Health, and who did a tremendous job dealing with the earlier echo in the discussion. Dr. Elizabeth Crossman, Regional Psychiatrist of the Western Regional Health Authority, Professor Wendell Abel, the Head of the Department of Community Health and Psychiatry in the University of West Indies, Dr. Michael Tucker, the Director of National Council of Drug Abuse, invited speakers, guests, ladies and gentlemen. It is a tremendous pleasure to bring you greetings on behalf of Dr. Chris Etienne, the Director of the Pan American Health Organization, and Dr. Tedros, the Director General of the World Health Organization, at this opening ceremony of the Mental Health Lecture Series in commemoration of World Mental Health Day 2021, under the important theme of mental health in an unequal world, the haves and the have-nots. Both the WHO and PAHO have always placed great importance on mental health, and has been included in WHO's well-known definition, which states that health is a state of complete physical and mental and social well-being, and not merely the absence of disease or infirmity. The WHO also conceptualizes mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Jamaica and the rest of the world has been involved in the response to COVID-19 pandemic since January 2020, and COVID has taken a tremendous toll on the mental health of virtually everyone. Those who have been infected, those whose loved ones have been infected or have lost their lives, those who have been caring for affected persons on the front lines, whether a part of the health care services, those tasked to plan, organize, and put policies and resources in place at all levels in order to bolster the response to this pandemic and reduce the burden of population, and each of us as we maintain our many relationships within the context of important public health social measures. Our economic and social well-being are deeply affected. Mental health systems, typically under-resourced, as Minister Tufton mentioned, under-resourced prior to the pandemic, have been further challenged with meeting the increased demand for essential mental health and psychosocial support services brought on by the direct and indirect consequences of this pandemic. Faced with the challenging new realities of physical distancing, working from home, job losses and insecurity, homeschooling of children, grief and loss, and the lack of physical contact with loved ones and friends, many of us are experiencing feelings of fear, anxiety, sadness, and at some point in time, many of us have learned where our coping limits are, and many of us, unfortunately, have crossed over that line. These factors have given rise to the development, exacerbation, and relapse of a range of mental, neurological, and substance use matters, particularly in a range of vulnerable groups. Emerging research has begun to underscore the immense influence of COVID-19 on our youth's mental health, including higher risks for developing anxiety, depression, post-traumatic stress disorder, and substance use. Mental health and psychosocial support, ranging from counseling to emergency services, are foundational to our COVID-19 response. The region of the Americas, inclusive of the Caribbean, South Central, and North America, must urgently improve the quality, accessibility, and resilience of mental health programs, now more than ever. Countries must adapt the ways in which they provide mental health services to safely offer care, including through telemedicine, community-based support. PAHO is committed to helping member states build better, stronger systems that extend mental health services to every corner of the region. The Interagency Standing Committee has issued guidelines to enable humanitarian actors to plan, establish, and coordinate a set of minimum multi-sectoral responses to protect and improve mental health and psychosocial well-being in the midst of an emergency. The guidelines offer essential advice on how to facilitate an integrated approach to address the most urgent mental health and psychosocial issues in emergency situations such as this one. Following the guidelines of the Interagency Standing Committee, the PAHO Jamaica office has collaborated with the Ministry of Health and Wellness and other agencies to provide mental health and psychosocial support training for staff at homes, for the elderly, infirmaries, and national quarantines and isolation sites, as well as to health workers that are working on the front lines of the pandemic. These trainings equip participants with the skills to identify and respond to those in need of care or to provide appropriate referrals. Many of you here today have collaborated with us in this regard, and I appreciate your support. The PAHO Country Office has also facilitated training in mental health literacy for teachers and go-to educators working in schools to help them identify and appropriately refer adolescents that are in need of corresponding care. We are currently partnering with the Child and Adolescent Mental Health Service Unit of the Ministry of Health and Wellness to provide specific care and attention to adolescents who have come into conflict with the law. We are also working to facilitate the establishment of the Mental Health and Psychosocial Support Technical Working Group that will help coordinate the range of services that are being delivered across the country and work to use the best evidence-based approaches. We know that mental health and well-being and one's ability to respond and receive appropriate care are influenced by a range of factors. I therefore commend you for taking this approach during this lecture series where you explore the differences and inequities that exist in the society that have been made more evident by the COVID-19 pandemic. By casting light on these inequities, only then can we take action to resolve them. It is my expectation that the discussions and presentations over these days will stimulate action towards the breaking down of these barriers that exist between the haves and have-nots and make for improved mental health opportunities for all. And in this regard, I thank you very, very much for this opportunity. Thank you.
Thank you very much. Thank you very much, Mr. Stein, for your greetings. And we note your continued support of Jamaica and the Caribbean region generally in terms of their response to the COVID-19 pandemic. I also note you highlighting the fact that we are in a time when we're seeing even further depletion of the funds in terms of supporting mental health services, which you rightly so mentioned are fundamental to the COVID-19 response. We do look forward to seeing some kind of focused attention as we move towards instituting some of the projects that you are and programs that you're supporting, and we are really, really very happy that you continue to support us at this level. I just want to mention something that that Minister Tufton spoke about. We have seen significant closures right across industries, from education, as I mentioned before, to employment, doors being closed. And of course, with that, an increase in risk of suicide and all of that. But we have seen and continue to recognize that the COVID-19 has really dealt a serious blow to mental health services. It was already, as Mr. Stein mentioned, under-resourced, and we're seeing that we really and truly need to make greater effort at pulling ourselves out of the crisis that we're faced with at this particular time. The high percentage of disruption among our children and women mentioned by the minister is something we're going to have to deal with. But he also underscored that in every opportunity, in every crisis, there is an opportunity, and this is a game-changing opportunity to address the inequities towards and working towards a more resilient system. So we're happy to hear from the minister and about all the work being done by the ministry right across the country to safeguard access and opportunity in mental health care. As I said before, we have many speakers, and I'm not going to try and bore us with too many comments from the presentations. We'll just go straight into the other speakers. So we have Dr. Kevin Goulbourne, and we have Mr. Andrade. Yes? Did I get that right, Mr. Sinclair? Mr.
That was correct.
Andrade Sinclair. They always say if you keep practicing when you're ready for it, it won't come in. But that's how it is. So we're going to hear from Dr. Kevin Goulbourne, and Dr. Goulbourne completed his MD with specialty in psychiatry at the University of the West Indies Mona campus, and he serves as a regional consultant psychiatrist for the Western Regional Health Authority, where he has administrative and clinical responsibilities in mental health and substance abuse services development, planning, coordination, and delivery. During his fellowship year, he focused on drug treatment practices and policies to help improve service capabilities in Western Jamaica. And guess what? He finds time to assist with the Southeast Regional Health Authority, and he also finds time to be responsible for clinical supervision and teaching of our medical students, our nursing students, psychology and social work students, as well as pharmacy interns. Dr. Goulbourne will be followed by Mr. St. Andrade Sinclair, who is formerly the Chief Executive Officer of the Maypen Hospital in Clarendon and has a Bachelor of Arts in Political Science and Masters in Health. In Health Administration, beg your pardon. He is the current Regional Director for the Western Regional Health Authority. Over to you, gentlemen, starting with Dr. Goulbourne.
Mr. Moderator, Dr. Patrick Prendergast, thank you for a word of introduction. Dr. Harvey, Senior Medical Officer at the Cornwall Hospital. Dr. The Honorable Christopher Tufton, Minister of Health and Wellness. Mr. Ian Stein, POW WHO representative in Jamaica, Bermuda and Cayman Islands. Dr. Naydene Williams, Director of Health Services Plan Integration in the Ministry of Health. Mr. St. Andrade Sinclair, Regional Director of Western Regional Health Authority. Mr. Everton Anderson, CEO, National Health Fund. Ladies and gentlemen, boys and girls, good morning. It is indeed a pleasure to bring greetings on behalf of the Mental Health Unit in the Ministry of Health and Wellness at this, your second virtual mental health conference in the Western Regional Health Authority under the theme of mental health in an unequal world, the have and the have-nots. How did we get there? I'd like to commend the mental health team in this region and all the other regions for doubling their efforts on a daily basis to provide quality mental health services in spite of various challenges which have been multiplied during COVID-19. This World Mental Health Day theme has brought into sharp focus an issue which has been magnified by the current COVID-19 pandemic. The current pandemic, in some cases, worsened pre-existing mental health and substance use conditions. It has also precipitated the onset of mental illnesses and substance use disorders directly due to COVID-19 virus affecting the brain, and indirectly due to its negative impact on our various sectors of society, such as health, financial, security, and education. This pandemic has posed a significant challenge to the resilience of individuals, families, and communities. Thus, this COVID-19 has forced all well-thinking Jamaicans to act in strengthening our alliances, collaborations, and partnerships to ensure that investment in mental health is prioritized, particularly during this time within the context of COVID-19. COVID-19 pandemic has impacted on mental health services, and in so doing, there's also magnified disparities that existed in the mental health services. Adverse impacts and disparities include the disruption of the access to regular public mental health services, both in our clinics and in our hospitals. This is partially due to reduced clinic and inpatient space within hospitals with a rising number of COVID-19 patients. There's also the widening gap between the need for treatment and the availability of treatment, especially affecting those in a lower socioeconomic bracket who are dependent on the availability of the government National Health Fund subsidized medications. There's also been disruption of the supply of regular psychiatric medication. And there's a further delay in access to the improvements that we have in medication, social and psychological treatments, which may have proven effective in enhancing the quality of life of persons living with mental illness. This is particularly prominent as it relates to newer medications that has proven efficacy, but with an expensive entry price, it becomes very limited for persons who are at social economic status which is low to access these medications readily, and hence are denied the benefits of these newer medications and innovations. There's also decreased access to socio-economic opportunities for stable patients, such as jobs, training, housing. Now, whereas a diabetic patient can be admitted to a hospital for treatment for out-of-control diabetes, when he or she stabilizes, he or she can readily return to previous place of employment. But from my experience, a psychiatric patient doesn't face a similar fate. If he's similarly or she's similarly hospitalized due to out-of-control mental health condition or substance use problem, in many cases, they are not really allowed to resume their job, even if given a fit medical certificate by the attending physician. The Minister of Health and Wellness, the Honorable Dr. Tufton, would have mentioned some of the interventions of the Health Ministry to decrease the disparities and adverse impacts of COVID-19 on persons living with mental illness, or those who may be becoming emotionally and mentally distressed and may have gone to use substances and have substance use disorders. To repeat a few of them for emphasis, these are the Reach Out Rangers, which is part of the COVID-19 Community Mental Health Response Program, the 24-hour toll-free mental health and suicide prevention helpline, the ongoing mental health media campaign, Speak Up, Speak Now, and a shift from institutional care to community-based mental health services. Another intervention by the Health Ministry is to work closely with the National Health Fund to make available newer and more effective but more expensive medication to persons in the public system who otherwise would not be able to afford them. We have also worked with the Human Employment and Resource Training National Training Agency, HeartTrust NSTA, in using employment program to help persons living with mental illness whose conditions are stable to enter private sector workplace through job coaching and supervision provided under this program. We have also embarked on our telemental services, which have been another intervention which was initiated during the pandemic. This allows for easy access to mental health services for those who, for a variety of reasons, including the pandemic, found it difficult to access mental health services. As mentioned by Mr. Stein, we have been cooperating with the PAO in establishing mental health psychosocial support technical working group, which not only will provide assistance to persons at the community level during COVID-19, but should be there onwards, provide assistance to persons in the event of any man-made or natural disasters. The World Health Organization has recommended a greater investment and reallocation of resources to more equitable, cost-effective, community-based mental health services. The Ministry of Health and Wellness has been making steps to fulfill this recommendation. The World Health Organization also, by its primary focus today, has stated that mental health care for all, let's make it a reality. So let us work together to make mental health care for all a reality and not just a dream. And as always, let us remember that there is no good health without mental health. So on behalf of the Mental Health Unit in the Ministry of Health and Wellness, I congratulate my colleague, Dr. Elizabeth Kosman, and her team for staging this timely conference and wish for you, the participants, a stimulating and productive engagement over the next few days. Thank you.
Good morning. Should I go ahead now? Go ahead, okay. On behalf of the Western Regional Health Authority, the Department of Psychiatry, the Department of Sociology, Psychology, and Social Work, WJC, PAHO, and the Mental Health Unit in the Ministry of Health and Wellness, I say welcome to all the members on the panel. Welcomes to all the members in the audience. Welcome all. Mental health, the World Federation of Mental Health celebrate mental health every year, October 10th through 15th. This year will not be any different for us, as this year marks an unprecedented era that we have seen for over 100 years with this COVID pandemic. It has caused displacement, and not only in the have-nots, but also with the haves. But most important to note is that afterwards, after this has all gone, what will come after? If we can recall in the Vietnam era, what happened with post-traumatic stress syndrome, namely the PTSD and many other associated names that they have described this onset after the trauma of death. We have seen it all here in Jamaica and in the wider part of the world, in the wider part of the Caribbean, how this disease has devastated communities and country. We are still plodding along as our numbers continue to decline, but we are still far from where we need to go. In this year that we have chosen, the motto or the quote for the haves and the have-not is very fitting, because inequality in the world is not equal. And those of us who are vulnerable, especially those that are the have-nots, we will see the mental health challenge that will manifest in time to come. So with this initiative that the Western Regional Health Authority, in association with other distinguished guests from the University of the West Indies, Dr. Orville Taylor, our presenter today, I say this is welcoming, and this is the way forward that we need to trod on to try and clear things up after the devastation has taken hold. Ladies and gentlemen, I welcome you all to this panel over the next couple of days, and I hope this seminar will bear the fruit that we're trying to gain. Thank you very much.
Thank you so very much, Mr. Sinclair, for, should I say, relocating our theme for us, asking that question, the haves and the have-nots, and reminding us that even when we speak about inequality and being unequal, we still have to remember that those who are unequal, there's still some level of inequality among that group. Quite an interesting way to put it. And we thank you for the support, the continued support and the endorsement of this critical exercise. I particularly want to note Dr. Goulbourne's charge to us to work together to make mental health for all a reality and not just a dream. We are happy to hear of the new initiatives, including improving telemedicine and, of course, the emphasis on community-based interventions. Those of us who know me well know that I welcome anything that says community-based. But I would love for it to be stretched beyond mere interventions to initiatives so that we begin to reflect some of what is also coming out of the community. We have one last speaker to bring us welcome and greeting, and that's Mr. Everton Anderson, CEO of the National Health Fund, who is a major sponsor for us. Mr. Everton Anderson has been the CEO of the NHF and an ex officio member of the NHF Board of Management since January 2013. He has held various positions as a health administrator, including Regional Director of the Western Regional Health Authority, Chief Executive Officer of the Cornwall Regional Hospital, and Parish Manager in St. James, Westmoreland, and Hanover Health Services. So he's no stranger to the West, really. He obtained his Bachelor of Science degree in Management Studies and his Master of Business Administration in Public Sector Management from the University of the West Indies, Mona, and is a fellow in the American College of Healthcare Executives. Please welcome Mr. Mr. Everton Anderson, CEO, National Health Fund.
Yes, good morning, everyone. Moderator, Dr. Patrick Prendergast, Dr. Derek Harvey, the Honorable Minister and the team from the Ministry of Health, Dr. Goulbourne, the team from the Western region, Dr. Crosman, Ms. Georgia Rose, the Regional Director, Dr. Sinclair, the guest presenter, Dr. Orville Taylor, our rep from the Pan American Health Organization, Mr. Ian Stein. Ladies and gentlemen, good morning. It is my pleasure to represent the National Health Fund at this conference this morning. The National Health Fund has been a key partner in mental health services for many years. And this we do through three main avenues. The NHF card program, which provides subsidies to Jamaicans, and we currently provide subsidies for 17 conditions. Interestingly, two of those conditions are major depression and psychosis. Last year, we spent $95 million in providing subsidies for these conditions, and on the program currently enrolled are approximately 73,000 Jamaicans for those two conditions. So we are indeed a key partner in mental health services, and we provide these services on the individual benefits program through over 450 participating pharmacies across Jamaica. In addition, the National Health Fund took over the management of public sector pharmacies a few years now, and we have strategically expanded the pharmacy network to improve access to pharmaceuticals, including mental health drugs. In fact, last year, 750,000 Jamaicans accessed pharmaceuticals through the National Health Fund drug serves. As we speak about haves and have-nots and use the word equity, we recently had to even open up our drug serves to having some private prescriptions filled at our drug serve pharmacies, including some drugs for mental health, because the cost of these drugs in the private setting was proven prohibitive for many patients. So we are supportive of the thrust to improve equity and really improve access for every single Jamaican. So we're very pleased to be a partner with the Ministry of Health and today specifically with the Western Regional Health Authority as we celebrate Mental Health Week and look at how we can improve mental health services across the country. The National Health Fund is also involved in sponsoring and supporting programs, and this is just one of the activities that we have supported, and I want to publicly recognize Dr. Crossman and Ms. Georgia Rose. Even in difficult times, they find ways of lobbying to get their programs going, and it augurs well for mental health in Jamaica because like them, there are many other persons pushing daily to improve mental health services. So I want to recognize the work that continues to be done. So as we start Mental Health Week, I salute all mental health professionals in Jamaica. I know the work sometimes is not easy, but you continue to turn up, you continue to show up, and you continue to work in the best interest of the patients, and we acknowledge your work, we acknowledge your contribution to nation building. And even during this difficult period of COVID-19, I know that you have been called upon to support in so many ways. So I want to stand with you. The entire board and management of the National Health Fund want to stand with you. We are here to support you, and we congratulate the organizers of this conference because we have to keep the mental health agenda on the table, and we do so through many avenues, through drugs, through conferences, through discussions, and through ongoing support of each other. So we stand with you, support you today, and we continue and commit to being a partner in mental health care as we work to ensure that in a few years there'll be more haves than have-nots as we work to minimize inequity. So I congratulate again the organizers of this conference, and we assure you that the National Health Fund will continue to play our part as a key partner. Have a wonderful conference and a good day. Thank you very much.
Thank you very much, Mr. Everton Anderson, Chief Executive Officer of the National Health Fund, and as he says, a key partner in not only putting on this conference and keeping the momentum going in relation to mental health issues, but broadly speaking, serving the wider society in terms of health services. Where we take note of the fact of your opening up of DrugServe to allow for greater equity in terms of access to given the serious mental health challenges that you have identified. And note that, you know, it's a frightening number for me, I will tell you, 73,000 Jamaicans who are benefiting from the subsidies provided, particularly in relation to depression and psychosis. You are indeed a key partner. And I too want to salute the NHF for their support, and certainly to extend their salute and congratulations to Dr. Crossman and the team for keeping the mental health agenda active and you know, getting people to respond in the way that you have, even in these critical times. So we have other sponsors. So I want to thank you, NHF, for coming to the table, and we want to also recognize Sagicor as a sponsor and give Ms. Yolando Sutherland, a representative from Sagicor, an opportunity to speak to us.
Good morning. You're hearing me? Are you hearing me?
Yes, go ahead.
Okay. So good morning, everyone. Pleasantries to Dr. Prendergast, our moderator, Dr. Derek Harvey, Senior Medical Officer for Cornwall Regional Hospital, Dr. Christopher Tufton, Mr. Ian Stein from the PAHO WHO representative to Jamaica, Cayman Islands, and Bermuda. Dr. Kevin Goulbourne, Director of Mental Health and Substance Abuse. Mr. St. Andrade Sinclair, Regional Director for the Western Regional Health Authority. Mr. Everton Anderson, CEO of the National Health Fund. Dr. Crossman, the instigator for this conference. Really appreciate the invite for Sagicor to partner with the mental health conference this year. I'm sorry.
She's there.
My vision, I'm trying to get up.
Her end?
Okay, are you seeing my screen?
Not yet.
Oh.
You do have permission to share. Maybe I think she's using 2 devices, and probably.
I see that I have permission.
Right.
I put to share my screen, but it's not coming up.
And we're seeing an attempt to share, but we're okay. You want to come back to it? Ms. Sutherland?
Yes.
Would you be able to stay with us? So
yes, I'll stay with you. I'll stay with you, and I'll
all right.
Invite. You know.
Thank you. So we'll see how best we can sort out that technical glitch during the presentation from our keynote speaker, and then we'll come back to that because we also have another sponsor presentation. Before I introduce our guest speaker, I just want to take time out to thank our sponsors, PAHO, the Ministry of Health and Wellness, National Health Fund, Sagicor, Pfizer, Janssen, and Hilton Hotel, among others. And certainly we will recognize our contributors as we proceed. It is that time of the morning when we hear from our keynote speaker, Dr. Orville Taylor. Dr. Orville Taylor is senior lecturer and head of the Department of Sociology, Psychology, and Social Work at the University of the West Indies, Mona. I almost said Western Jamaica campus because he's such an integral part of what is happening here at the Western Jamaica campus, and I know he will salute me for mentioning that. He's actually the man in charge of the academic department from which a major part of this very critical engagement on mental health comes. He's an award-winning columnist, author, educator, and radio talk show host. He's popularly known as the Man in Black. Dr. Taylor hails from Waterhouse, an inner-city community in Kingston, and credits his parents for instilling in him a love for education, which has taken him from St. Patrick's Primary School to one of Jamaica's top high schools, St. George's College, then onto the University of the West Indies Mona campus for undergraduate and graduate studies, before heading off to Florida International University, where he was the first PhD in sociology. Dr. Orville Taylor is a member of the American Association of Black Sociologists and has written several articles and book chapters on the subject of race, the African diaspora, and labor studies, and has presented more than 50 conference papers in both Spanish and English. Among his awards are the 2016 UWI Best Publication Award and the 2014 Maurice Cargill Award for Opinion Journalism. He's also a specialist in international labor standards and has produced several country and regional reports. He will also have you know that he is no longer listed among Jamaica's most eligible bachelors, because Dr. Taylor is married and has a daughter. He will address us for a while, and then right after, hopefully, he will stay with us and take some questions after his presentation. Ladies and gentlemen, please welcome Dr. Orville Taylor. Man in black.
Bless you. Good morning. Good morning, everyone. Good morning. Good morning, everyone. I'm getting a little bit of delay and feedback. I hope you can fix that. Yes. I don't know. Are you hearing it? It's a loop. We call it loop when we're doing radio. So in fact, I'm hearing my voice like 5 seconds afterwards. Yeah.
Okay.
Are you right? So it's right. So it's coming through, and I'm hearing myself again. So I don't know if I have to pull out and come back in. I don't know, but it's I'm hearing myself at the same time while I'm talking. It was very, very disturbing. It wasn't so earlier on. I'm not sure what's the deal.
Yeah. Do you have two devices opened?
No, none whatsoever. No, I'm only using my cell phone. No, none whatsoever. No, I'm only using my cell phone, actually. Tell you what, let me try to see if I tell you what, let me try to see if I Wi-Fi.
Okay. Are you back now? Is that any
better? Let's see. I don't know. I'm going to go. I'm still hearing the double. It's so inconsistent for somebody like us. I don't speak. What will be more disturbing is whether we're all hearing it. The only one here. I'll be all right. I'll be continuing. So is there anybody else who's hearing the kind of feedback? I'm good to go. I'll work with it. These are difficult circumstances. Difficult circumstances require that people stand up and face the music. So I'm not very, very big on protocol, so I'm going to ask you to forgive me if I do not single out all of the major players here by name or by institution. Of course, bearing in mind the fact that we are hosted by the Ministry of Health and the Minister of Health and Wellness is here, I definitely, sir, I am going to have to acknowledge you and our representative of PAHO and all of the other entities who I may very well forget. I'm sure that you understand as well that I am one of those persons coming from out of COVID with the PTSD, and that it is very, very real. And it has also had some kind of impact on my short-term memory. So forgive me for that. So don't like the introduction to be longer than the speech. So I'm going to go ahead and say thank you all. Yes, Prendy, you are quite right that you also didn't do the disclaimer though, that you and I are real good friends and colleagues, and it's a privilege having worked with you. And Western Jamaica campus, in many ways, you have demonstrated what is good and what is right about the University of the West Indies. I can't understand just how, with so little bit of resource, you and Georgia, both of you, and your team have managed to keep the place running. There are other parts of the university, you know my mouth has no restriction when it comes to being truthful, that have more resources and are not doing as well. But the question that is facing us, and here I am, a sociologist, at the beginning of Mental Health Week, Mental Health Day, talking about mental health. I certainly am not going to be the one to come before you this morning and be giving to you some kind of a lecture about our presentation as to what mental health is or what health is. No, I don't need to do that. I don't need to go to the church and say who Christ is, because you all know what that is. I am a sociologist though. And being a sociologist, one of the advantages that I have is that I tend to understand how things relate to each other. So I have a tendency to think systemically. So we are asking about how we handle this issue of mental health and mental wellness in a world that is fundamentally unequal, in the middle of a pandemic, in the middle of a crime or homicide pandemic. And we ask ourselves the question, how did we get here? The big question is, were we ever not here? You know, we like to talk about history. My first degree is in the humanities. And in the humanities, you know, I did a lot of history too. And one of the things about history that bothers me is that history really is subject to the pen of liars. And so whoever is most powerful at the time will write history and not R-I-G-H-T it. I'm wearing today evidence of my African ancestry and my Black presence, and I wear this chain consistently, whether or not I have on a suit, because I believe that all of this thing that we have has a deep history. We are a population that has been mentally ill from day one. We have had mental illness because we have been a population that has been abusing each other. And we understand the vicious cycle from the days of slavery to such an extent that even today, among you and me and all of us here who are remnants of this plantation society, we don't even recognize just how mentally enslaved we are. And let me give you an example. There's a test I use from time to time. And follow me, I want you all to pay attention. You are representatives of families. You are heads of families. You own children. You have responsibility of children and students. But you have to take care of your own mental slavery first. There's a running theme through some of my presentations where I say we're talking about oranges about oranges and crocodiles. So here's one of the tests that I use very frequently. Psychologists and psychiatrists in particular pay attention to this one. We have children and we ask them to do these little drawings, or we tell them to do coloring. By the way, let me do a correction. I have a son who is going to be 4 in a couple of days. So I'm still firing. I have a wonderful little boy who thinks the world of me until him go a little bigger, right? So I have a 4-year-old. So when we are doing the coloring, and he's very astute. Some of you will know that I am a fine artist as my first love. I paint and I draw and stuff. And I'm very mindful of color. They say men don't know color, but it's not true. I'll tell you the difference between cyan and fuchsia and rose pink and hot pink and all of those things, and the difference between turquoise and teal and stuff. I know color. So we get the blanks from the books, the coloring books, and we give our children, pay attention. We give our children a box of crayons, and we say to them, color the most popular citrus that is there. No, it's not a lime. It's not a lemon. It's not a grapefruit. The most popular citrus that we consume in Jamaica, not the tangerine either, not the ethnic Jamaican one, the mandarin. No, nor the Ortenique. No. What is it? The orange. So before we move on, do the coloring in your head and then ask your child and tell me what you ask your child to color. And the data say, and the studies that we have done and the interventions that we have done point to almost every respondent, including psychologists and psychiatrists and sociologists and people with behavioral science degrees, and teachers, early childhood education, etc. The great majority of you, yes, you who are in this room, allow the child, as a matter of fact, don't allow the child. Tell the child to use orange and color the orange orange. Am I right or am I right? I'm right. So you color the orange orange. Or when the child uses another color, or green or something, you say the child is wrong. But you fully well know the persons who are not resident in Jamaica can be excused because they are familiar with Florida and California oranges. But Jamaican oranges are not orange. And the second test is to color the crocodile. We live in a country where it's okay to call him alligator. That's all right. You don't know any better. That's fine. We're good. No difference. No, that's not a problem. You're not biologists or herpetologists. No. Nah. But why would you color a crocodile green? So follow me here. If you are comfortable with a fake notion of something that you know isn't what they say that it is, and you indeed correct what is true into some image of what it is, some simulacrum of what the people say that it is, how then are we going to get ontological gratification and at the same time be saying that we are not all mentally ill? And for me, the hallmark of mental illness is being unable to grapple with this thing called reality. Because people operate on the basis of what they perceive to be true. We call it the phenomenology of truth. So if you want to make a real difference, if you want to ask yourself the question as to how we got here, you have to answer the question in your head that we've always been here. We are a population that came out of slavery. And when we were halfway out of slavery, we thought that we were out, and we are not out. And because of the lies that were told to us during slavery, and we have embraced them, we are very, very uncomfortable with truth. And because we are uncomfortable with truth, you know, believe it or not, there are things that the pastor, the reverend will tell you and be preaching to you on a Sunday or on a Saturday that are totally not biblical. When I look at the scene, one of the most important events in history, in Christian history, that is the birth of Christ. When you look at the scene when Jesus was supposed to have been born, all of that is nonsense. There were no 3 wise men. Jesus was never in a stable. There's no evidence of that. But we believe it to be true. So we are the same set of people who doubt the data when the data come before us, and we say that we are mentally okay. So we have these diatribes and these dialogues and our narratives in our head about things like the female-headed household, and the children having children, and the picking them out, all of these things. We don't get it. We're uncomfortable with the data. And we live in a country where we're in the middle of a pandemic, where people are so stupid when it comes to understanding numbers, that on the one hand, when I say to them, or when we say to them, yes, we know that it is true, that the majority of people who will get COVID will not have the kind of outcomes that I had or other people like Michael Sharp, my dear friend, had and died. It is true. Out of every 100 people who get COVID, you know, about 90 odd people are going to live. Yes, that's true. But people want to play the fool with those odds, thinking that they are good odds. However, when you look at the possibility or the probability of them winning any kind of money from lotto, they're willing to take the chance. So the same person who thinks that the astronomical odds of making some money from playing the numbers game are worth risking, and you only likely get a couple of dollars, right? You're willing, however, with greater odds of being ill or dying, you're willing to do the risk with your lives. But one of the problems that we have had is that we have a credibility problem with the people who have been giving us information over the years. There are a set of people who we believe more than others. And there are a set of people who, no matter what they say, you never believe them, even though they're speaking the truth. So as we look at, say, things like the female-headed household, and we jump and we read the book, the cover of a book called My Mother Who Fathered Me. And My Mother Who Fathered Me was a book that spoke about, guess what? 30% of households that didn't have a resident father. Nobody realized that. The majority of households in this country have a father. And even when you crunch the data and you look in the middle of the pandemic at the percentage of the population that comprises a woman who's living alone with her children, nothing about whether or not she has a man, just whether or not she lives in a with a father's children. You're talking about 18%. 18%. The same set of people don't even get it. That there's a magical 7 going around or 70% going around. That will pop up as we do an analysis. So while we look at 70% of our students right across universities being female, and we look and we see the majority of our judges being female, the majority now of our lawyers being female, where engineers are no longer having men overrepresented. What we're seeing is an increase in female-headed households. That is young women not having children or living by themselves. That comprises about 9% of the population. Yeah, about 9% of the population. 21% of the population comprises, I think, men living by themselves. Single individual household. And when you work out the math, what people are not comfortable with those data. So when they talk about increasing in female-headed household, they say all other kinds of things. But let me tell you some things that are very consistent with the theme that we have been hiding behind. People don't like liars. People don't like liars and liars come in all forms. But the worst kind of a liar is the kind who uses position to victimize. Follow the connection. We have a national anthem, a beautiful hymn. Eternal Father, bless our land. And it goes on. Yes, right. Teach us true respect for all. There's a notion of being equal and equitable in the way in which you treat others. So here we are, facing COVID, facing homicide, 2 pandemics at the same time. For the first 6 months of this year, the number of persons dying from violence and the number of persons dying from COVID were running neck and neck, very, very close. And true, the demographics of people who were dying was different because 70% of homicide victims and 70% of perpetrators of homicide fall in a particular age group, which is pretty much the same set of boys who are not at the university. While, of course, the set of people who are dying of COVID form a different kind of demographic. But what does that say? So we're in the middle of a pandemic, and we want to understand how we got here. We know also that never mind the poster children as to who represents what. There seems to be enough evidence surfacing about the selective way in which people have been treated by the WRHAMr and the way in which the police have been carrying out their action. There's a view that there has been bias at the political level and undue pressure being put on some people who want to do better, some of whom might be even in this room. But because of collective responsibility, have to take particular path when decisions are taken. There are those views there. One of the worst things you can do to a population that you want to behave better is to victimize them. Because victimization, especially at the social class level, is the same thing as abuse at the psychological individual level. And institutional abuse, remember, we're an abused population from slavery. Institutional abuse creates abusers. What we have done with the last few years of our lives, and over the last maybe 30 years, is that we have continued to focus on inequities with disastrous consequences. In 2000, year 2000, what did I do? I did a presentation at the Mona Academic Conference, and I saw the wave coming. And by the way, there is another wave coming. I saw the wave coming, and I saw what was arising called indecent work. And there is inherent in this thing called indecent work all of the problems that we are facing now. Indecent work, the antithesis of it is decent work. But indecent work, which is victimizing people at the workplace, follow me, not paying people an equitable wage, not treating people, giving people social and emotional and job security, treating people as expendable, and all of those other elements, translate to the increase in mental illness and the increase in low productivity and the increase in violence. Don't be mistaken. The kind of person who will shoot and kill or cut off the neck or head of a young person, sorry, of an old person is not a person who's quote unquote sane. It takes a certain kind of pathological criminal to carry out the kinds of homicide, the kind of horrific things, including rape and stuff like that. A person who's a pedophile is a mentally ill person. A person who is a murderer, a mass murderer, is a mentally ill person. And when you check out it, I don't have to tell you, most of you are behavioral scientists here. There is a strong correlation between people who have been abused and the social outcomes later on. Abused become abusers later. No two ways about it. Abused will the next generation of abusers. So how do these demographics work? So at the workplace, what we have done, and even though we have seen a decrease in the unemployment levels, what we have seen consistently is that even though we have had increases in employment over the last 30 years, what has been increasing is underemployment and the increase in indecent work. There is fragile employment. It is easy for people to get fired, even with the ability of individuals to engage trade unions and attorneys and go straight to the Industrial Disputes Tribunal. What we have seen between, say, the end of between the late 90s and the late 2000s is like 1,000% increase in the number of complaints. Yes, by the non-unionized workers in the Ministry of Labor. And I mean, we're not talking about going to the Industrial Disputes Tribunal. When you fire an individual, you typically fire a family. And so one part of this thing that has taken place is that it increases inequity because it's already unequal from the beginning. But when you fire this individual, you typically, in a society like Jamaica, with all of the kind of trappings coming from history, you fire the 16-year-old, 17-year-old boy who has other kinds of ambition, the very same one who's going to be kicked out. Because you see a family that is hungry will still make the sacrifices for the young girl who has even got pregnant to go to school, to go to university. And females at the university have different kinds of support. And I was saying earlier on today, it is much easier for a female student to go to a female lecturer or even a male lecturer and say, sir, miss, I'm hungry today. Males don't do that. We're not socialized to do that. So a woman will come to school on a whim, knowing that she doesn't know what to eat. But a man will not be able to do that, worst of all, if he has a child. So you kick, by firing the family, right? You kick that 16 to 17-year-old boy out. He doesn't go to sixth form, he doesn't go to university. And if he doesn't get employed or properly employed, you want to hear where he goes. I don't think you have to guess, that's what. Not a problem at all, none. But there's another dimension to this that we have to talk about, the dangers of indecent work and victimization and all of those things. Let us say that the individual remains in the workplace. The individual remains in the workplace. So this individual remains in the workplace and becomes victimized by the boss. A person who's victimized, a person who is abused, needs a channel to get rid of that abuse. Well, you can't abuse back the boss. And you can't really abuse your equivalents in the workplace. So you abuse your subordinates. But let us say that you're at the lowest or the lowest end of the continuum and you don't have people that you have the ability to abuse. Because, you know, when you are harsh to somebody who is your peer, it's just that you're obnoxious. That's not real abuse in the institutional sense of the word. So you go home and you abuse your children. Let me tell you something from the research that comes from out of our department. My colleague Georgia Rose knows about it. She's a specialist in early childhood development. My colleague Herbert Gale understands this because he studies violence. My colleague, retired, but still my colleague, Claudette Crawford Brown, she understands the dynamic about parenting and children and viral children, etc. We understand this. I spend more of my studies on violence looking at it from a policing side, but I understand it. It makes sense. So according to the data coming from out of the research, it is not the absence of father from the household. That is there. It may be the absence of both parents that works. So if you don't have your parents, absolutely, you're very likely to become homicidal, without question. But the great, great, great majority of men who are raised by women who love them don't do the foolishness, don't become homicidal. I can tell you, I mean, I had both my parents, but it's my mother who, when I was growing up in Waterhouse and in Brook Valley in Duane Park, when my friends were holding the gun, it's Miss Ivy. Miss Ivy had so much stature that when Miss Ivy stood by the gate when the Brook Valley Sherlock War was starting and a fellow jumped over the fence one day with an AK-47, Miss Ivy did this. And boy jumped over the fence with a firearm. I think he went to fire it elsewhere, but he wouldn't do it, not in front of Miss Ivy. Here is what the data shows. You can come in. And here's what the data shows. The data shows that where mothers victimize their children, and in particular, where mothers torture their boys, that's the single most important factor. So where your mother victimizes you as a young man, where the mother is present, she victimizes you and she calls you the carrion crow, she calls you the jungle, and she beats you like you were the West Indies cricket team or the Reggae Boys last week, right? When she does all of these things to you, she ties you up and she tortures you, right? The data suggests that the greatest likelihood, the greatest single determinant of your becoming a mass murderer is the torture from your mother. But a mother who tortures, who has been treated unequally by the system, not just her spouse, because if she's single, she got rid of that relationship, but she's working and she's struggling, but she has a boss who treats her in an infrahuman way, she's going to take it out on her child. So the boy becomes victimized in two ways. He becomes victimized, right? He becomes victimized, one, because he is kicked out of the family and he's going to have to be taking care of himself. But he becomes victimized because his mother, who nurtures and hugs him and shelters him from all of the harm, is the one refuge that hurts him. So when we think systemically, we have to understand this, that listen, when you're hurting individuals, you're not really hurting individuals. So right, you're hurting an entire family and therefore an entire nation. Rewind to the beginning of what I said. Let us be very truthful. There are times when policymakers or big men and women are uncomfortable with what is before them and what is true. Yeah, man. You might think I'm not going to touch it, but I'm going to touch it. So, for example, we know, and I stand with the Ministry of Health and Wellness here. Let me say it again. I stand with you because I paid attention when some of the things were happening which would have led to the spike, and I asked some of the questions, and some of the questions were neatly answered. Yes, Tufton, I know you're listening, right? And I'm saying, I heard the answer, and I understood it from a subliminal sociological, socio-psychological perspective as what you were saying. I understand the collective responsibility, but the experts inside and outside of the health ministry, who in the medical and other profession, the behavioral profession, understood exactly what was likely to happen when certain things took place. We understood that. I paid attention as a member of the media as to what the mandates were in terms of vaccine, and I have yet to find anything that is contrary. Bear in mind what the Ministry of Health and Wellness has done in terms of what the mandate was. When it gets to that point, if I have the evidence, I say it. I don't go by narratives, I go by evidence. So similarly, you know, people are talking about things, you know, Prendy, I don't know what kind of issues you had with your examinations or Georgia, right? But we had a report about some increase in examining irregularities. That's fact. I dare anybody who, because they're uncomfortable with information, to come and say anything else. They have contrary information, fine. I don't have, all right. That's when you don't have ontological gratification and verification. And when you have that level of mental illness that leads into things called abuse, institutional and stuff otherwise, we don't have time to that because the consequence of it are too great for us to bear. I know I'm slated to have 45 minutes, but I'm not going to take the 45 minutes because in these online presentations, it can become a little onerous. So let me just say this to you. We are responsible for everybody else. But first of all, we are responsible to ourselves. Those of us who live on this little piece of rock in the Caribbean Sea understand that we don't have anywhere else to go. We go too far, we're going to fall off. So we are going to have to fix this among ourselves. But we can't fix it by treating some people differently from others. But how are you going to be treating somebody better or equal or the right way if within your own mind you can't come to terms with the truth? You have to kill the lies. You can't lie to yourself simply because you have the ability to speak or you have the ability to quote unquote change a narrative or to change the data. Because when you, as a, say, a policeman, murder a boy, you have murdered him, no matter what the statement says. When you have carried out an abortion, you have carried out an abortion. You're not going to talk about it as a miscarriage. We know it was not a miscarriage. We understand that, right? When you beat up a child, you beat the child up. Never say the child fell or anything like that. When a person was dismissed unfairly from work, the person was dismissed unfairly from work. Don't say that the person abandoned their job. So we, in order to get ourselves away from where we have always been and to move to the next level, let us be truthful. Let's be truthful to ourselves and let's be kind to ourselves. So we got here because we are always here. We created and we maintained a system that was built on inequality. Let's reduce the inequality because we can't end it. Because inequality in itself is one of the most dangerous things and one of the biggest causes and consequences of mental illness. I thank you. I'm not hearing. I'm not.
We're hearing each other, but are they hearing me? Are you hearing me? Man in black?
Yes, we're here now.
Okay, thank you.
I'm hearing you again now, Fendi. Yes, I'm now hearing you.
Thank you, thank you. Thank you so very much. Great. As usual, Dr. Taylor, we can depend on him to really stir some, what should we say, stir something inside of us to get us thinking about things a little bit differently from how we would normally see it. Big question we've put for you to answer. How did we get here? The haves and the have-nots, how did we get here? Mental health in a world, in an unequal world. And you're saying that it's not a question so much about how did we get here, but essentially were we not already here? Citing history, connectivity with history, citing the vicious cycle of violence that we have seen being perpetuated upon ourselves and upon others. We've heard you raise questions around our comfortableness, or should we say how uncomfortable we are with dealing with the truth, and how that in itself contributes to this vicious cycle of abuse. And further to that, the whole thing of, institutional abuse. Positions of influence, you've asked us to look at that. How do we actually use our positions of influence? And charging us to remember that positions of influence should not be used to perpetuate this abuse. We've seen an increase in mental health. We've seen an increase in violence. And as per usual, I know that whatever, I shouldn't say it this way, but whatever topic you give Dr. Taylor, Dr. Crossman,
145 pounds, yeah?
Dr. Taylor, Dr. Taylor, I see you
right.
You did make a point about the issue that we have with credibility.
Yes.
And I see you are one to make sure that everybody knows whatever connections you have with whoever else. Open disclosure, full disclosure, as we would call it in media. And
absolutely, yes.
It's good to hear you also state your position with the minister, with the ministry, with your colleagues, because it's social capital is one of those areas that we definitely have to work on if we're going to deal with what I love to call, we're in a state, at the start of this pandemic, and I did mention it last year in my comments, I made a post about having to deal with infodemic whenever there is such a global pandemic. And I think we're seeing the consequences of not addressing that early enough.
Yeah.
So I think though we have a few minutes for a couple questions, and hopefully, Dr. Taylor, you can take
no problem.
Take a few questions. Okay. So the first one I see here is, how do I move this now, Andre? Okay. So there is a question: what is being done? What is being done to reduce the amount of mentally challenged persons living on the street before they harm others? I don't know if anybody in the group wants to take that, but certainly, Dr. Taylor, you may want to take a shot at that as well. I don't know if you can speak to the specific. Are there any provisions to allow the average Jamaican access to therapists or psychiatrists to help with tracking mental illness? Those are two questions that we have on the table.
A big part of it, though, has to do, I think we'll have to come from out of here, where to recognize that, first of all, we need to change the face of mental illness, because homelessness and the person, is the most extreme form, I suspect, right? But there's a far greater frequency of mental illness across the spectrum in Jamaica. Everybody knows that. And the other side of it too is that because a significant portion of the persons who are on the street are not psychotic, they're just simply unfortunate, right? So that kind of confounds it a little bit. The police have consistently said to me, though, that it is not part of their training to deal with people who are mentally ill. So that may very well have to do with a modification in their overall training, or more in-service training. I used to be at the National Police College, and that was an area that, we introduced psychology and a little sociology and history in it, but in terms of the hands-on and understanding of mental illness, etc., it's not there. And they're not equipped to do that. The other part of it, though, I think will have to do with some area of legislative reform, where you have the stature in law, to act, right? And I think that the law has a number of gaps. We have at least one attorney who's in this group, and she might be competent to have this. This might be an area of law that she's familiar with. That the law needs a little bit of reformation in order to empower the police and the government to have different levels of control over people who are mentally ill and roaming the streets. So I think that there are gaps in the law as well. But I think beyond all of that, there is a fundamental lack of real understanding, a fundamental lack of empathy relating to mental illness, etc. There's a whole lot of stigma surrounding it and stuff, and people don't quite get it. Yesterday I was in the presence of, I'm not going to say where I was, because some people too fast, right? But there was a family there, and there was a young man who clearly had a developmental disorder, right? Right, a clearly developmental disorder, and that's my son, by the way, being very, very clingy, right? So there's a developmental disorder that individual had, and I just didn't think that the other persons around clearly were sensitive enough to it. So what we can do from our side, without any question, is to use our channels to increase the level of knowledge and sensitivity that comes with the knowledge regarding mental illness. Right. I hope I answered it.
Thank you very much. You're citing the need for additional training or more training, and of course, on the legislative side, action to, to empower those who are providing the response. There is a question. I know this one is specifically for you, Dr. Taylor. Why is the relationship between the mother and child always looked at when an issue arises with the child and not the issue with both parents?
So the last time I checked, the idea of a man carrying a child was a misconception as opposed to a conception. So the most fundamental relationship has to do with that the mother-child. I mean, the biological behavioral scientists and stuff will talk about the primacy of that bond. I have never said I hope you didn't understand my saying that. I never said that, or I didn't want anybody to get the impression that absence of both parents doesn't affect the child. I'm saying that absence of the mother, simply because of what mothers do typically. You can try as much, but men don't breastfeed, right? There are all the other things. Yes, I was with this child that is being very fussy because he wants me to come and take him up. I was the first person to change his diaper and all of that too, and he's very, very cuddly with me. But there are things there are things that a mother does that biologically it bonds the child to the mother in a particular way. And so the psychologists and psychiatrists among you who can talk about the Oedipus complex and all of those kind of things which point to the relationship, that primary relationship, mother-son relationship. In the same way, a similar way like the father-daughter relationship, where fathers will kill you over their daughters, etc., but might beat you up over their son. Mother-son, really, really, really tight. And so, like for me, Miss Ivy was what kept me going, right? So, the more qualified psychologists and psychiatrists here can speak more about the primacy of the mother-child relationship or mother-son relationship. But where there's any weakness in that primary mother-son relationship, then of course the consequence of that would be greater. And that's what I am saying. But I am absolutely not saying that the role of the father in carrying forward this is not a significant one. So, you have a bad father who's a shotter, you're likely to become a shotter as well. If your father has a good relationship with you, right? But it is very possible that you could have a pretty good relationship with your father and at the same time have an abusive relationship with your mother. And as a result of that, you still end up becoming a murderer. But the data show, and these are secondary data from Dr. Gale, I'm not stealing his work, is that in cases where you have a single mother and the single mother is abusive, right? So therefore there is no recourse. So I'd imagine also that if you have a single mother who's abusive, but the young boy has the ability to request to his father, that would be a mitigating factor as well. But when you have single parenting and an abusive mother, it's a death knell. Yes.
I have one more question for you, Dr. Taylor. What structures are in place for persons who are victims of police brutality and need psychological help, as a strong fear has developed within them?
I think that you guys might have to be able to answer that. The people from the Ministerial Health Authority, what kind of resources do actually have to available to the public? I know that the public health system itself is under great pressure. There are individuals, such as the individuals and private entities, such as churches. Unfortunately, many of the churches don't have the abilities. They think that they have the ability because the Bible apparently teaches psychology, but it doesn't, right? But they offer some levels of counseling as well. But as far as I do know, that there are indeed public resources available. I think you people from the ministry can assist me there. There are some individuals, though, among us who are known to us in the Department of Sociology, Psychology, and Social Work, who would be willing to offer some amount of assistance, some of which is paid, etc. Yes.
If there is anyone from the in the group who would like to address that, but we are making a note of it that that may be one of the questions we put to the presenters over the coming week. Right,
yeah.
Dr. Crossman? All right. I have one last question for you, though. I thought I said a last one, but I have one last one. What advice do you have to offer people who are scared of asking for help? Offer people who are scared of asking for help.
No, I heard you. I heard you. No, without. No, I heard you. I heard you. No, without. I heard you.
You know.
I think the first thing that because it's so hard to tell you in a vacuum if you hope to trust somebody who you don't know. Right. Start with a discussion. Start with somebody who you probably have the greatest level of trust in, and hopefully in a particular direction, because trust. I mean, fear is healthy. You know, fear is necessary because it prevents you from jumping and doing things and sticking your neck out and jumping off the deep end and drowning where you can't swim. So we're not talking about blind trust. It's a process. There are some individuals who build up a record over the years. You know, it's kind of the same kind of. I mean, if you pay attention to what's going on in the music fraternity now, based on the revelations of Stevens, where it has taken many, many years. She has kind of gone through some of the things she's been raped, still refusing to identify who the individual is, even though we're beginning to suspect who it is. And to speak to somebody about and I don't want to stick my neck out and say, well, you know, go ahead and trust whatever. But you start with that one person who you trust first, right? Who will then maybe go to another level of somebody else you trust. Outside of that, then you go institutional, because the institutions tend to have checks, balances, etc. So, ministry, you know, Chris, put the stuff out there. You know, those of us who are like mega actors will do our part in getting the knowledge out there.
Right. Thank you very much, Dr. Taylor. Thank you so very much for your contribution to this opening ceremony, to give us a great start to what we know will be an excellent week of presentations on the topic, mental health in an unequal world, the haves and have-nots, how did we get here? We really appreciate your contribution, and we appreciate the contribution of all those who have participated in this opening ceremony. Just as to underscore the point you made to that last question, don't be afraid to start with somebody who you trust. Just ask for help, but start with somebody who you trust. Thank you again, and have a good afternoon, sir. We're going to return to two presentations to close off the opening ceremony. The first by Ms. Yolanda Sutherland of Sagicor, and the second by the National Health Fund. But I understand that I have some giveaways, and I have two questions that I want to put to our participants. Do I put them at the same time? Or do I ask one, and how will we? Ask one now and then at the end? I think Ms. Sutherland is sharing her screen. Okay, so the first question is, let me quickly get back to that question. I'm coming right to you, Ms. Sutherland. I see you're ready this time. So name 3 sponsors of our National Mental Health Week conference. Name 3 sponsors of the Mental Health Week conference. That's question number 1, and I'll get you question number 2 afterwards. Now let's hear from the Sagicor rep, Ms. Yolanda Sutherland.
Thank you again. Good morning. Thank you again. Good morning. I am going through to move from here. So looking at financial wellness, financial wellness looks at the balance between having a healthy state of wealth today while preparing financially for tomorrow. So financial wellness actually exists when a family or a person can live worry-free the way they want to live for as long as they live. Now, their money problems and mental health issues are actually intrinsically linked. According to the Money and Mental Health Policy Institute, poor finances often lead to stress and anxiety that can further impact finances. In 2019, the Institute found that 46% of people with debt also have a mental health. So we actually look at the cycle of money and mental health problems being linked. So financial difficulty leads to financial stress, and stress and anxiety can also be worsening depression, anxiety, because of the activities, so like a collections agent, help the person, you know. And then of course, mental health problems come in the cycle. So the importance of financial wellness cannot be overemphasized because it's a major factor in handling uncertainty. Persons may experience depression and or anxiety because of this uncertainty. With the ongoing pandemic, it has become obvious that numerous persons do not have a fund or life insurance. So the most vulnerable among us could not manage financially, their jobs were affected, or provide for one if heaven forbid they died in a premature way due to COVID-19. Since this pandemic, I've had several persons reaching out to me looking for life insurance coverage, as well as to review the accuracy of their current plan. As a financial advisor, I would sit with you via virtual or in-person meetings to look at where you are now, where you want to go in terms of your goals, and then help realizing what you are, where you are, and help with your goals with those solutions. So giving individuals and their families some peace of mind. So insurance can help. We look at the 4 cornerstones of financial planning. So you need liquidity like cash, equity. Then we look at disabilities. Heaven forbid you lose a limb, the loss of vision, you're not able to work. Disability income could come from critical illness plan. Family security would come from life insurance because if you die having young children, leaving a life insurance plan to ensure that there will be continued income for them. And of course, as a living benefit, pension annuities and retirement plans are also necessary because you work all the way of your life. At the end of work, you really need to still be able to live comfortably. So a pension plan, retirement plan. So life insurance is going to offer your family protection. So there's less burden on your loved ones. Life insurance is going to offer final expenses. The funeral costs are high, and you want to be able to cover these costs as well as cover medical bills and debt. Because even if you pass away, if you have a mortgage, your life insurance is mandatory to make sure that debt is paid off if you pass away before the mortgage is finished. Of course, estate planning. It's a lot of people don't realize that having assets to leave to your family is all good, but you also need to protect those assets. Utilizing life insurance policy to be the money that's paid out rather than having to sell home to pay the legal fees to transfer the hope to the benefit. So with life insurance, we're going to guard against the unfortunate. The life insurance is a benefit to your family. Critical illness insurance is a living benefit to you. So if you are diagnosed with any of the critical illnesses covered, the heart attack, stroke, cancer, a payment would be made directly to you, the insured, so that you can take care of your medical expenses, living expenses while you're unable to work. There's also personal accident insurance, like accidental death and dismemberment, individual health plans, so you can pay for insurance that need medical services like accessing a psychiatrist. You'd be able to claim with your swipe card or a claim. And life insurance is not just about insurance. We also offer investment plans. So you can have life insurance linked with investment, which we call it equity plans. And then unit trust investment, fund investment, individual pension, and retirement solution. I am available at 876-38-971. My name is Yolanda Sutherland, financial advisor with Sagicor Life. And you can reach out to me or contact from Dr. Crosman, and I would be able to help you with the review or free no obligation consultation on your financial security.
Thank you very much, Ms. Sutherland.
Thanks again to the team for having me.
Thank you for making the connection between financial wellness and mental wellness. I can tell you, and it's not just in terms of the investment opportunities that you have presented or the financial opportunities that you have presented, but also as somebody who drives regularly on the highway between Montego Bay and Kingston, I see how you have also managed to capture our thoughts as we travel along as we travel along that roadway.
Or has you covered.
Yeah. All right. So thank you once again, and I'm pretty sure that we'll reach out to you, those of us who will need further advice. And as you've mentioned, the team here will be able to make contact with you as well through you. So thank you. And we have a sponsor presentation as well from the National Health Fund. I'm not sure who the representative is at this time, but we're going to ask the National Health Fund to make their sponsor presentation. Okay, good. Oh, so our technical team need to identify that or to find the material so we can go straight. In the meantime, what I will say is that I'm pretty sure you'll agree with me that we've had a really exciting morning, insightful as well, and I know that you are looking forward to the rest of the week. We have activities each evening, Monday, Tuesday, Wednesday, Thursday, all the way down to Friday, right, Dr. Crossman? All the way down to Friday. We have critical presentations coming up tomorrow evening and Tuesday evening as well, and we have some workshops going on Thursday and Friday all week. And I have a question that I'm going to pose, so I think you should all listen carefully as I go through what's coming up. Tomorrow evening we'll start at 5. That's Monday, October 11. And Professor Wendell Abel, who is always with us and always willing to share, he's going to be doing a presentation, In It for the Long Haul, the long-term mental health impact of COVID-19. He will be joined by Dr. Jeffrey Walcott, Speak Up and Speak Now, Real Challenges in Disclosing Mental Illness, and of course, Mr. Michael Tucker, What's in My Cup, Tackling Substance Misuse in Youths. That will be tomorrow. That's Monday, the 11th. And then on Tuesday, October 12th at 5 p.m., we'll have Ms. Georgia Rose, who is clinical psychologist and lecturer here at UWMONA Western Jamaica campus, will be speaking on innocence under arrest. Innocence under arrest, childhood in the age of COVID-19. And that will be followed by a panel discussion, My Body, Not Yours, the adolescent's right to consent. And we'll have a distinguished panel. Panelists include Dr. Sheila Campbell-Forrester, public health consultant, Mrs. Genevieve Harty, attorney at law, Mrs. Andrea Stennett Douglas, a parent, and Mr. Victor Newsom, principal of Irwin High School. Having given you that, I'm going to pose another question. Are you ready for the NHF presentation? All right, so let me just put the question back. Question number 2. Did we get an answer for question number 1? Awesome. You have the winner we can announce soon. All right, so we'll have that. Question number 2. What is the theme of National Health Week? Sorry. Yeah. What is the theme of Mental Health Week? And name one other presenter that will be participating in the upcoming days. I hope you were listening because I gave you a lot there. Over to you. question 1? And is it, did I hear a name? Question number 2. We also have a winner for question number 2. And that's Soshana. Soshana Campbell is the winner for question number 2. And how we have their registration information, right? So we'll be in contact. And for question number 1, Leah Bain. All right. So for question number 1, that's Leah Bain. And for question number 2, Soshana Campbell will be in touch with you so that you can receive your reward, I love to call it, for participating and answering the questions correctly. Now we're going to bring this exercise to a close. I'm going to ask Dr. Janice Clark to express thanks on behalf of everybody.
Ladies and gentlemen, what an awesome launch to our Mental Health Week activities. On behalf of the Western Region Health Authority Mental Health Services, as well as the Department of Sociology, Psychology, and Social Work of the WRHAMr Western Jamaica campus, it is my honor and privilege to sincerely express thanks to all those who helped make this World Mental Health Day opening ceremony possible. Most important of all, I wish to recognize and extend my most heartfelt gratitude to our Lord and Savior, who by his blessings and grace, we have been able to make this event what it has been this morning. A special thanks to our own Dr. Gavin Austin, who led off the ceremony, especially this being his birthday. What more testament of a psychiatrist than to be born on Mental Health Day? Thanks to Dr. Naydene Williams for bringing the proclamation which opened the activities on behalf of the Governor General, Sir Patrick Allen. Special thanks first to our moderator this morning, Dr. Patrick Prendergast, who graced us with his presence and efficiently guided us through the program, adding his own insightful comments. To the group Hearts of Praise for their excellent presentation, and to Dr. Harvey for his prayers, we give thanks. You know, normally Mental Health Week is launched with a church service, so after these 2 items, we felt like we weren't missing out on church at all. Thanks for special greetings from several speakers, even though our moderator had thanked them as well. First to Dr. the Honorable Christopher Tufton, the Minister of Health and Wellness, to Mr. Ian Stein, the PAHO representative for Jamaica, Bermuda, and the Cayman Islands, to our own Dr. Kevin Goulbourne. I say our own because he was with us at Cornwall Regional for many years before moving on to the Ministry of Health. To Mr. St. Andrade Sinclair, the Regional Director of the Western Regional Health Authority, and Mr. Everton Anderson, the CEO of the National Health Fund. I would like to acknowledge the keynote speaker, Dr. Orville Taylor. We want to express a very special thank you to him for being with us this morning. It has been a sincere privilege for us that he delivered the keynote address. We thank him for honoring us with his words of wisdom and insightful observations and comments. Special thanks to our sponsors this morning from Sagicor. Ms. Yolanda Sutherland gave a nice presentation, and also to the National Health Fund. We are especially thankful to the WRHAMr Western Jamaica campus for hosting us here this morning and for providing efficient technical services which allowed the smooth running of this ceremony. Most of all, we'd like to thank our audience for taking the time to join with us this morning and encourage you to join us for 2 days of invigorating, exciting talks, which start tomorrow, Monday, October 11 at 5 p.m. Thanks again, everybody, and have a blessed day.
Thank you so much. Have a good afternoon.
Thank you too. Take care.
Mr. Clark, I never usually come back after thank yous, but I really need to just remind us that we have a special children's workshop on Wednesday, I Can Cope, and an adolescent workshop on Thursday, I Can Dream Again, and you'll hear more about that. But I also want to just take time out to recognize the planning and production team, Dr. Elizabeth Crossman, Miss Georgia Rose, Miss Jodian Hastings, Mr. Janeth Foster, Miss Melissa McHale, Miss Andrea Irving, and of course, Dr. Janice Clark, as well as the participating doctors, Dr. Gavin Austin, happy birthday, Dr. Jorin Austin, Dr. Arlene Wilson, Dr. Nori Shante McKnight, Dr. Azazi Owi, and Dr. Monique Hemmings. Thank you all. And yes, a lot is being done. There is much more work to be done. And we here and all around, we must continue to do everything we can to improve access to mental health services, especially given the challenges of the COVID-19 pandemic. Thank you very much, Instigator-in-Chief, Dr. Lisa Crossman, and as Ms. Clark already said, have a wonderful afternoon, folks, and see you again tomorrow at 5.